Welcome back to Medical Monday, everybody.
Welcome back.
We're going to be going over a topic that's very important because it affects about 25 to 30% of all Americans. And what it is diabetic-induced neuropathy, meaning neuropathy caused because of your diabetes.
Yes.
Well, Dr. Gabby, why does diabetes cause neuropathy?
Diabetes causes neuropathy because it actually affects our vascular system. And by vascular system, I mean our veins and our arteries. So what it ends up doing is it causes like hardening and dying. I like to describe it as dehydration of the blood vessels. And so that's what happens. Those blood vessels in the smaller aspects of our body, like our fingers and our toes, will become dehydrated. And so therefore, those nerves don't get proper blood flow. That tissue doesn't get proper blood flow. And so it just over time dies off because the body's not communicating or getting enough nutrition.
This is a great representation because this top nerve is just engulfed with beautiful blood vessels delivering oxygen, nutrition. As these blood vessels become less and less, now this sheath that actually covers the nerve and helps the electricity conduct through there is going away.
Correct, and that's exactly what happens. Even more prevalent in diabetic-induced neuropathy because that is the most common cause of neuropathy.
Yep. And the Mayo Clinic noted that that's about 50% of neuropathy, of all neuropathies, are caused from diabetics.
Yes.
This is uncontrolled.
Uncontrolled. That is a very key word. We're going to hit on that quite often throughout this presentation is uncontrolled. Uncontrolled. Now, the nervous system. Have you ever heard of a highway system?
Yes, we have a few of them around here.
Okay, well, I know you're from a small town.
From where I'm from.
Oh, okay, all right.
But around here in the Houston area, yes.
So I like to describe our nervous system as like a highway system. We have larger aspects that then break out into branches, that then break out into branches, that then break out into branches. When we talk specific about peripheral neuropathy, we're talking about smaller appendages like our fingers and our toes, our feet and our hands. It typically does not get to the torso, but it works from farther away into the torso because we're dealing with these little bitty guys here. Similar to the image we just had talking about the progression of neuropathy, this is a picture of a nerve and that's it. And so you can see how the nerve itself goes into progression into smaller and smaller and smaller aspects. And so we are talking about the tiniest of tiny nerves that allow us to feel even the texture of our fingerprints, right? We have fingerprints, and if you do this, it's like a cricket. But if you have neuropathy, you can't even feel your fingers touching, you know?
And why it occurs in the hands and feet first is because that's the farthest away your cardiovascular, your blood vessels go. So they get very, very tiny. Unfortunately, because of the uncontrolled diabetes, the tiny blood vessels are affected first. Now, that makes a lot of sense because your big ones are not going to be the first ones affected. It's going to be the smaller ones furthest out into your fingertips or your toes. And that's where we traditionally see most patients start complaining about symptoms such as numbness, tingling, burning sensation, difficulty wearing shoes, difficulty at nighttime trying to sleep because the covers are over their feet and it's just they can't take it. It's just an over sensation because the nerve no longer has that sheath to cover it and it's just overreacting.
Correct. Overreacting. It's hypersensitive. I like to describe it as if you've ever played sports or gotten a raspberry where it's just all rubbed raw. That's exactly kind of what it is to the nerve because it's not able to actually do what it needs to do and function the way it needs to function. So one of the easiest ways actually to work with this, if it is something that you have symptoms of or know somebody that you have symptoms of, is to actually focus on lifestyle. Something you can do at home. Diabetes is actually an effect of an unhealthy lifestyle. And so typically you know over the years that you have a high A1C or that your blood sugar is high. And these are factors involved in your body unable to process things. So one of the best and most effective ways to, one, deal with neuropathy, diabetic-induced neuropathy, but also help control that blood sugar is through lifestyle management.
Diabetes, there's two types of diabetes. There's one that just occurs because we're naturally not born with the ability to process insulin, and then the other one occurs over time because of our lifestyle has now caused our body to not be able to process insulin properly. And that lifestyle is, your high calories, your high fat, not exercising.
That's what I was say. Very inactive, sedentary, very processed. Very, very processed. Lots of things out of boxes and aspects.
So the number one thing is, if you want to prevent your diabetic neuropathy, control your diabetes. That's really the bottom line, is what we'll see throughout this. As far as if you have diabetes, know how to monitor your diabetes, know what your diet should be, and also keep track of how well you're doing based on the different foods that you eat.
And there are tons of resources out there if you need help controlling your diabetes. Online, there's tons of different aspects and resources that are available to help learn how to better monitor and really make some of those lifestyle changes. But what happens is sometimes we kind of get overwhelmed or we're just not able to take care of it ourselves.
Sometimes food is too convenient.
Ooh, let me tell you something.
We know fast food is fast, but it's just too convenient.
I do love me some food. So when it's convenient and I'm hungry, it becomes a problem. But there are other resources that are available professionally. And so sometimes you need to reach out to your primary care or any provider at that sense to see if there's an option out there for like a registered dietitian. They specialize in actually, controlling and cleaning up and taking care of what needs to be taken care of to get that diabetes under control, to prevent the neuropathy from one, progressing, and then two, really taking care of it and reversing it.
And we see this throughout the spectrum of healthcare. It's known more and more that diet is a big part of neuropathy. So a lot of larger clinics, and especially hospitals, do have classes that are offered to newly diagnosed diabetics or diabetics that are now decided, hey, I want to take control of this, and just please give me some nutritional help because I feel lost. There's so much online, and you hear about this fad diet, that fad diet. Does it work? Does it not? You really got to sit down with a professional sometimes to weed through what's really going to work best for you, because that's the big part. If it's not something that you can do or you can follow, it's really wasting everybody's time. So make sure it fits you.
Yeah, and that is a huge factor with just about anything with medicine. Not to change the subject, but that is a huge factor with anything in medicine. So very, very true statements there. From there, what happens is if it ends up not being controllable with lifestyle management, there is the need for prescription type drugs to help control that blood sugar so that you can process things properly. And the great thing here is I always love to describe it as it's a resource. As you continue down that journey, as you try to control and get things back where they need to be and where they belong, these are phenomenal resources through that journey to get where it needs to be and maintain it so that you can continue to make that progress.
Definitely so. Because diabetes is, a life-threatening disease. So if you don't control your blood sugar, one, you keep it too high, you end up with neuropathy, you end up with other health conditions. But if you just totally ignored it altogether, it's very life-threatening. When I was in the hospital in the ICU, we see many patients come in with their blood sugar in the 700-800s, and of course we got the ones on the far end of the spectrum that didn't follow their medications properly, and then we're in the low 20s, 30s, and 40s. So be sure to monitor and take the advice of your healthcare provider who's helping you with this so that you're taking the right thing for you.
Yes, that is very true. But in an unfortunate case, it gets out of control. We're not quite able to manage it with these things, and the neuropathy continues to progress and worsen. And that's when we get on different prescriptions that actually can affect how our body is able to communicate and how we can really cognitively function. It is needed because what it does is gets those feet to not be as intense. It allows you to actually get a restful night's sleep. The thing is, long-term use has some side effects, and it's just
we look at what they're for. So these medications, now this is the actual, before we were talking about diabetes medication, to control your diabetes. That's the number one thing, control it.
Yep.
If it's not controlled and now you do progress into diabetic neuropathy, you're going to have those pain, those numbness, tingling sensations, and you're going to want some sort of relief. The thing is, the medications that are giving for the relief are not fixing the problem. What they're doing is they're blocking the signal, so that your brain no longer receives the signal that, hey, my feet are on fire. They still feel inappropriate because the nerve is not functioning. The only thing is your brain is not getting the signal.
Correct. And that's the major difference when it gets to that point. What is great about everything that we've talked about today is there's actually an answer out there regarding how to fix this peripheral neuropathy.
Yes.
It's a very unpleasant process, and what's phenomenal is there's 20 plus years of research out there specific to reversing the effects of neuropathy and getting you that life back that you deserve, or your loved one, or your neighbor. There's just so much out there, which is why we always talk about these things.
Yep. We're just here to let everybody know.
Yeah.
Some of the things that we do here, which are really good, involve home therapies.
Mm-hmm.
Now, I like home therapies because that prevents patients from having to travel to the office. It prevents a lot of confusion because they're doing it at home. It's very simple.
Oh, yeah. And it's convenient.
What do they do at home, though?
Yeah, absolutely. So it's convenient as well. You can literally do this while you're reading the newspaper and eating your breakfast. So there's 2 different therapies, home therapies, that we specifically utilize to help treat peripheral neuropathy. And one of them is light therapy. A low-level light therapy specifically designed and FDA certified to treat and correct the effects of peripheral neuropathy. And another one, electrical therapy, that's actually utilized by the Cancer Treatment Centers of America to reverse the effects of chemotherapy-induced neuropathy.
Yes.
And one of the
That's
things,
very good because
very good.
Neuropathy is neuropathy. No matter what causes it, whether it's chemotherapy or whether it's diabetic induced neuropathy, they're utilizing it at where?
The Cancer Treatment Centers of America.
For cancer patients who have had treatment, but it can still be utilized for diabetic neuropathy.
And you don't have to go there. You don't have to go here. It literally gets drop shipped to your home.
Oh, wow.
For you to take care of it at home. Yeah.
You're making it too easy. Why are we not getting treated? Why is this not being fixed?
Why? Right.
This sounds too easy.
It is. It's true. I mean, you got to come see us. That's what happens. So, and then we're going to beat a dead horse a little bit more. You're not on a diet.
This is why it's not getting treated. Diet's hard. And I understand that. We go through life and we have kids and we have a job and we have things that just make it sound as though it's very difficult to change your diet. But really those are just kind of excuses that we tell ourselves because we actually have a weekly cook that comes on. She's a busy mom of 4 kids. She homeschools. She does everything, and yet she still has time to cook very healthy meals. And she actually shows how easy it can be for you as well, to where it doesn't have to be this big difficult thing that ends up being a barrier, and it should not be.
Oh yeah, and I think more recently she did a dessert that was gluten-free, sugar-free, dairy-free.
That doesn't sound good to me.
Oh, but it was phenomenal. Everybody wanted more.
I heard the kids really liked it.
And it was 4
ingredients. If kids will eat
ingredients.
it, then maybe it is good. That should be the test.
4 ingredients. So there are some great resources and options out there, and a lot of times it's just a matter of stepping outside of our zone to learn more about it and to go through that process. So I do know like I said, we've beat a dead horse, but when we talk about neuropathy specifically, it's not about the diet. It's literally about the lifestyle and cleaning out a lot of those high inflammatory factors that exist that cause the neuropathy, that cause the lack of blood flow.
Yep.
And then also, what we're going to focus on is some regenerative medicine. There's a lot of scar tissue that exists from years of compensation, from years of lack of blood flow to the different aspects to the body. And so there are some regenerative injections that are performed in the lower leg to break up scar tissue and really increase flow and communication, which is
platelet-rich plasma. It's phenomenal ability to help those very small blood vessels come back to life. You know, when you cut yourself and you bleed, you know, your platelets stop the bleeding, but they actually start the healing because that cut has severed some of those small blood vessels. So that's what PRP does. It really helps to reinvigorate these blood vessels and start building around the area that's not getting good blood flow so that it can get good blood flow to those nerves.
Yep, and that's what's important with neuropathy is good blood flow.
Healthy blood.
Healthy blood.
Good healthy blood flow.
Healthy blood flow to help regenerate that myelin sheath on the nerve.
So 25 to 30% of all Americans have neuropathy. That is a big number, and unfortunately half of all diabetics get it. The big thing is control your diabetes so you don't get diabetic neuropathy. But also a big thing is there's more than just the people watching this right now who are getting this information that know people who have either neuropathy or diabetes. If you like, share, comment on the video, they can also get the information, pass it along so that we don't just hold this into ourselves. Let's spread it out and help as many people as possible so they know about their body and their health condition.
And how many people? 25
to 30% of all Americans.
Of all Americans. And we're on a mission to reverse that and reduce that number so that we can be a healthier society. So super excited to be a part of that movement. Always love being here on Mondays. So
and we will be here next Monday as well.
Next Monday, for sure.
So have a good one.
Yes.